Hi everyone. In today's clip, I will talk a little bit about fibromyalgia. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, fibromyalgia is a chronic condition which is characterized by widespread musculoskeletal pain, fatigue, sleep disturbances, and cognitive issues, which are called fibrofog, as well as depression, anxiety, irritable bowel syndrome, and migraine headaches. The modern medicine does not know the causes of this illness, and there is no specific lab tests for this either, and it is only diagnosed based on the symptoms that are described. So for managing fibromyalgia, the approved medications such as duloxetine, pregabalin or Lyrica, and milnacipran or Savella are prescribed. While these are specifically approved, other medications like amitriptyline or gabapentin and cyclobenzaprine may also be used off-label to help with pain, sleep, and muscle relaxation. So the best approach to treating fibromyalgia, though, involves a combination of nutrition, physical therapy, exercises, and lifestyle changes. On the orthomolecular side of looking at this illness, research has shown that many fibromyalgia patients have lower levels of vitamin D compared to healthy individuals. This deficiency can contribute to the chronic pain and fatigue that is experienced by these patients. Vitamin D's role in regulating calcium and phosphate levels is vital for muscle function and bone health, which can be compromised in fibromyalgia. Vitamin D supplementation can be an effective approach to alleviate some of the symptoms, and the recommended dosage may vary depending on the individual's baseline levels and overall health, of course. So generally, a daily intake of 2,000 to 5,000 international unit of vitamin D3 is suggested, plus K2, of course. But it's essential to monitor blood levels and adjust the dosage accordingly. Thiamine is another nutrient that helps in healing of this ailment. This is also known as vitamin B1. This is a water-soluble vitamin, which is crucial for energy production, nerve function, and muscle health. It acts as a coenzyme in the metabolism of carbohydrates, ensuring that the body efficiently converts food into energy. For fibromyalgia patients, thiamine's role in energy metabolism is particularly significant, given the condition's association with chronic fatigue. So high-dose thiamine supplementation ranging from 300 to 1,800 milligrams a day has shown improvement in symptoms. However, it's crucial to start with lower doses and gradually increase under medical supervision to monitor for any adverse effects. Thiamine is generally well tolerated, but individual responses can be different, of course. So other cofactors include magnesium glycinate, which will be 400 milligram or more a day, depending on the individual, CoQ10, 300 milligram or more a day, omega-3 fatty acids with 1,000 to 3,000 EPA or DHA active compounds, proper rest, massage, meditation, yoga, tai chi, as well as glutathione IV therapy. These are all helpful. On the metaphysical side of this ailment, holistically speaking, muscles are triggered by emotional states. So the cause of fibromyalgia is when the emotional energy has become stagnant or stuck in the boundary of the muscles in the body. Therefore, these suppressed emotions get trapped in the muscles and enable the feeling of being stuck. Muscles are holding on to basically control guilt, stubbornness, anger, rage, resentment, and this stuck energy in the muscles eventually leads to other symptoms of fibromyalgia. The emotional needs of a person with fibromyalgia tends to be quite different. There's a behavior pattern to the need for attention, yet the attention does not meet their specific needs. So they may have experienced, for example, a wonderful family environment, yet somewhere along the line, their specific needs were not met. Or their family environment was dysfunctional and the love and nurture that they needed simply was not given. Perhaps the love they needed and what they did not get, and what they did get did not match their expectation. Therefore, they became needy for attention. This need for attention becomes a pattern of dependence and seeking approval from those around them. So eventually, unconsciously, all their attention will be going outwards and towards their need for getting something back. Their energy is getting stuck in their body as their focus is on getting their needs met from an outside source. So then they get stuck in a pattern such as fear or letting go of their circumstances because of the fear of losing attention of their loved ones. They may also feel like a victim of circumstances, and somehow they begin to associate pain with attention. Deep anger, rage, and resentment towards a person or situation where they feel controlled, such as partner or a parent, a sibling, can also be a cofactor. The attention that they seek may come from a feeling that they have suffered enough. The approval they seek is to make up for their suppressed, unique emotional needs that were not expressed or understood. All of these aspects metaphysically mean that they have lost the ability to return to their own inner source for love or inner source of love. There is a strong connection between fibromyalgia, stress, anxiety, and depression. Unresolved emotion or unresolved emotional trauma, I should say, or chronic stress can disrupt the body's natural pain processing mechanisms, potentially leading to fibromyalgia. Fibromyalgia also may be seen as a physical manifestation of an imbalance in the body's energetic system. This imbalance could stem from unresolved spiritual issues, a disconnection from one's purpose, or in general, a lack of inner peace. Traumatic experiences, whether emotional or physical, can also leave a lasting imprint on the body and mind. And these imprints can affect the nervous system's ability to process pain signals, contributing to development of fibromyalgia. Now, it's important to remember that fibromyalgia is a complex condition with various contributing factors. A holistic approach that combines medical care with therapies and nutrition that address emotional, psychological, and spiritual needs will be quite beneficial. Don't be discouraged, because the healing can take time and be very gradual, because the healing is multi-level. One of the key aspects to consider is gentle body work, which is to get the energy that is stuck in the muscles and periphery of the body to move and reestablish a flow. The mind and body are connected. So by getting the energy moving again in the body, this helps reduce pain, refocus the mind, and get clear on the emotional state. So hope this has been helpful. Like and follow for more. Be the light.